It'll say. All right, Mayor, go ahead.
Thank you, Steve. Well, good morning and welcome to our 13th edition of the Mayor's Breakfast, our Zoom conversations to update residents on mostly things on all things on COVID and other issues that are here in the city. Introductions is Steve Spedowfski, and Steve is our Deputy City Manager, and he'll be taking the role of our City Manager today. We have our County Supervisor, Candace Andersen, who is returning again. And Candace, thank you for being here. Also coming back for another visit with us is Dr. Joseph. Dr. Joseph, thank you. We really appreciate your busy schedule to be here with us. From the city of San Ramon, our Director of Planning, Debbie Chamberlain, and she'll be talking about some of the things the city is doing to help our local businesses, retail and restaurants open up outdoor seating and other things so they can begin to reopen. And I'm delighted to introduce Enrique Gomez. Enrique is the owner and the manager of Mexxi's restaurant. And he really is representing our small business owners, our small businesses that run restaurants. And he's going to talk about what they are doing to keep you safe, their customers safe when they come to the restaurant. So Enrique, thank you for being here, sir. But I'll turn it over to Steve to start for an update and introductions about the city.
Great, thank you, Mayor. I'll be brief this morning. I'd like to highlight a couple of things, and I believe Joe might have mentioned this last week, but our summer camps are up and running. And what I wanted to add is that everything's going well with no issues. We're taking all the necessary precautions. We have the temperature checks before entering the buildings. And we're finding out, though, that kids need to calm down in the shade a little bit after running around in the sun before you check their temperatures. So that was kind of the lessons learned from the first week. And the other update that I'd like to give is that I believe it was last week, our public counters had a soft opening for residents for services, either at the permit center or at City Hall and police department. And you can go online to our COVID page, and under the changes to city services page, it's a listing of all of our public counters with different phone numbers to call. We are encouraging people to make appointments when possible to avoid having to either wait outside or wait in another area to socially distance. We do, in some cases, we provide virtual appointments where we can interact with residents and business owners over Zoom and take care of issues that way. So other than that, we're just moving along and opening things as we can in accordance with the county guidelines. Thank you.
Thank you, Steve. One of the things the city accomplished this week, and at our city council meeting, we approved after almost a 2-year study, was our parks master planning process. And folks can go to our website and download and look at the things they've accomplished. But it's amazing for a city that has over 63 parks and a number of new parks will be coming up. And San Ramon is very park friendly, and the work of our of our park commissioners, in particular Don Birnbaum, who is our chair of that, and the work they put over these last 2 years, I just publicly want to acknowledge their work, and to also the Parks Department and Kathy Hyman's leadership, putting together a very bicycle-friendly, pedestrian-friendly, open space-friendly format as we look forward to the next 10 to 20 years here in the city of San Ramon. So thank you, park commissioners and all those folks who got involved and went to all the workshops and helped put that together. Today's focus is going to be an update from the county through Candace Andersen. We're going to focus primarily on our small businesses and how they are working to meet the challenges of COVID, to be open for our retail and for our restaurants in particular, and what the city is doing to help that process work. And then we'll end our broadcast always on a high note by inviting Dr. Joseph to talk about the newest things that are going on with COVID and also to answer your questions. We get lots and lots of questions, and it's a great chance to direct that. And that is a good segue into, if you want to ask a question, address it to info@sanramon.ca.gov. And we'll receive those, and Steve will sort through those, and as time allows us, we'll be asking those questions to everybody. So I'd like to introduce and bring up Candace Andersen, our county supervisor. What's going on in the county, Candace?
A lot. Well, good morning, everybody. It is always a pleasure to join Mayor Clarkson at this morning breakfast that he has. And hopefully you're enjoying your breakfasts at home. So we're seeing kind of an alarming increase in cases. 2 weeks ago, when I was with you last, we are at 1,547 cases in Contra Costa County. We have increased over 1,000 cases. So we are now at 2,576 cases. Right now, we are averaging 68 new cases a day on a rolling 7-day average. 2 weeks ago, we were at 37. Yes, we're doing more testing, and which is great. And we would expect to see more tests coming forward. Those testing positive goes up and down a little, fairly consistent this week, about just under 4% of everyone we've been testing has tested positive for the virus. It is definitely still spreading within the community, within San Ramon. 2 weeks ago, you had 9 less cases than you do today. You're up to 55 cases today. So in the last 2 weeks, 9 individuals in San Ramon have come down with COVID. Where we are seeing some disconcerting numbers is the increase in hospitalizations. And in early June, when we were looking at those numbers, we were averaging about 13 people in the hospital each day. Now we're at 37, so it's nearly tripled. This is a significant increase. It's more than a 10% rise, a daily rise, which then puts us on a watch list, the state monitoring list. And so the California Department of Public Health has placed Contra Costa County on its monitoring list for the second time because of our continued increased hospitalizations in the county. Most of those are county residents. We do have 4 individuals that are from outside the county, including one from Imperial County. And so some key actions we're working on at the request of the state through our public health department, things we would have been working on anyways, working with some communities, community-based organizations to really focus on messaging about masking, other prevention techniques. We are seeing rises in certain ends of the county. And so that's where we're putting a lot of focus on. We're continuing to work with the hospital and health systems to just monitor their COVID-related hospitalizations, prepare for a surge. That's just the trend we're moving upward. And so we continue to prepare for that. We're continuing to provide infection prevention guidance to skilled nursing facilities, instruction, proper use of PPE, the personal protective equipment, because again, our most recent deaths have involved many of our deaths, not all, have involved skilled nursing facilities. And we're really focusing on more education in the community in multiple languages about the importance of also working with our county health on contact tracing so that we can prevent the spread to friends, to loved ones. So in just this last month, we've had 36 more deaths. We've doubled our death count. We are up to 72. When I was here 2 weeks ago, we were at 44. Now, when you look at the statistics, and this is all on the county's health website, and I know you've got a link to that on the great website Steve Spedowfski has for you in San Ramon, 99% of the deaths were people older than 50, 66% of the deaths were people older than 80. And so it is older. However, keep in mind that more people right now who are contracting it are younger. It's a trend that's very different than at the beginning. And so we are seeing many, many more people. None of you, unless you've had it and we've decided that antibodies are going to protect you, and we still don't know that, most of you are not immune. And you could still have very, very serious health consequences if you do get it. And more importantly, you could pass it on unknowingly to someone who is very, very vulnerable. So with this recent spike in cases, there is a serious concern with our health officers. And just before this, I did get off a call with our health officers. They are watching over this weekend because they find these so disconcerting. There is a likelihood or an increased likelihood or possibility that we could, and I'm putting this in very vague terms, but there is a real possibility that we would postpone our July reopening of some businesses if the trend that we're on right now continues through the weekend. We might have to delay by a week or two some of those July 1st openings that were so important to so many, which included things like indoor dining. I know we've got Enrique here who's, I know, preparing for that to happen soon. You know, the gyms, the nail salons, all of those things that are so important to people. We will know on Monday because we know businesses are already preparing, they're hiring people, they're ordering food supplies. All of those are very, very important factors, but we are very concerned with what the trend we're seeing right now, and a decision will be made no later than Monday. We're starting to get the word out that, you know, there's always been that little footnote in our timeline. It could be subject to delay. We do not anticipate rolling back additional shelter in place orders at this point. We don't anticipate, absent a significant surge, having to go back to where we were before, but nevertheless, we are very, very concerned. And we, you know, the positive of all of this is, yeah, we did anticipate seeing more positive cases once we are doing more testing. And the fact that we've been able to keep our positive rate below the 5 to 8% rate is a good thing, because it just shows it's further spread in the community than we knew it was, but nevertheless, it's not escalating at such an alarming rate. We are getting much closer to reaching our goal of 2,100 to 2,400 new tests to date. And Monday, we even had 2,700 tests. We still want you to get tested. It's really, really easy to get tested. As I've said before, at our county test sites, we're no longer doing the deep brain scrape. We're just doing a very superficial nasal site scrape. We've got a great site in San Ramon, very easy to get an appointment, and we continue to expand our contact tracing. We have already trained additional people that are starting this week. And so these are all things that we're looking at. We still have hospital capacity, but we are seeing more and more of our hospitals impacted, not so much on this end of the county, but for example, our county hospital, which serves many of the more disadvantaged populations, we're seeing a much higher hospital count of COVID patients than we previously have. And so we are seeing, though, you know, our hospitals are prepared should we have a surge. Those are all good things. And so those are some of the things that are making us a little nervous. We have had a significant outbreak in, it's now public, it was not made public until the media did, San Miguel Villa, which is in Concord, and that was an outbreak identified back on May 22nd. When something like that happens, our public health staff quickly reaches out to the State Department of Public Health. They are the regulatory agency, to request them to be on site to help assess infection control, prevention practices. And so we were working closely with Kaiser's infection control team as well. And so there was a serious outbreak, numerous deaths at that society. A lot of people have been asking about the role of the county in reopening schools. Our health system is working closely with the County Office of Education to help the districts come up with guidelines. And so the earliest that some local schools we're seeing in the county ready to open would be late July 27th out in East County. Our public health are saying that, you know, schools should be able to remain open even if an employee or a student does test positive, as long as they're following these important prevention measures, such as maintaining set cohorts of students, you know, having some physical distancing, face coverings, as is currently recommended both in the state guidelines as well as the county, again, working with Lynn Mackey with his Office of Education to come up with some universal guidelines that should be employed. And then it's up to each school district to really decide for themselves what that is going to look like, how they're going to implement it in their area. And we do have a great FAQs on our website now about schools that's been done in collaboration with the Office of Education. And so again, you know, timeline, we'll know Monday more. And, you know, that was the indoor dining bars, gym fitness, limited indoor facilities for leisure, such as, you know, pool halls, bowling alleys, indoor museums, hotels, and then the personal services that don't involve touching. So those are some of the things we're really looking at. Homeless, we're still doing really well in addressing our homeless population. And one thing I will say about temperature screening, because Steve did bring it up, our health officer did put out a statement, this isn't an order, on June 22nd, saying there's really right now little proof showing that temperature screenings help slow the spread of COVID. You're much better off doing the self-check on symptoms, other things. They really, what we're saying now is, unless the CDC, the Center for Disease Control, requires temperature screening in certain settings, that we're not going to require employers to utilize those and perform them, just because sort of, the kid running around might have a different temperature. On a hot day, you might have a different temperature. The quick screening isn't that accurate. So those are some of the things going on in the county, and we'll know more Monday about whether or not we're going to limit or delay our next opening.
Candace, thank you very much. So you made some really important comments and about what's going to be happening. So when is July 1st? What day of the week does that fall on?
That falls on Wednesday, is July 1st.
Falls on Wednesday. And there was an anticipation that the next opening up would have occurred on the 1st. And so the businesses like Enrique and others are thinking, but we're going to find out now on Monday, 2 days before, what they might look like.
Well, and we had a very robust discussion about that this morning, because up until today, we were hearing, our percentages were still below the 5 to 8%. Hospitalizations, we can control those. But given what's happening throughout the state, they said we want to look and see what the numbers are over the weekend. If they remain fairly consistent, I think we'll move forward with our July 1st opening.
Okay.
If in fact we see this very sharp upward trend, there is that possibility. And as I said, businesses like Enrique, they've got Cisco orders, they've got food orders already, made. They've got employees coming back. People have gone off unemployment because they, are counting on this July 1st start date. And yes, we've always had that footnote that says subject to, changes. But on the other hand, I will say the changes we've seen just in the last 2 weeks have been very, very dramatic in our county. And I've said to our health officer, get to the root of those cases. Are they tied to, outbreaks at San Quentin with employees who may be commuting? Are they tied to outbreaks in our residential care facilities? Things that you can really isolate with our contact tracing to those that don't affect the whole general population. And I know people have asked me before, well, our end of the county, we're doing pretty well. We're not seeing, even though, you've seen, 10 more people in San Ramon, for the most part, we're seeing the biggest spikes out in West County, but we're not able to segregate the county, nor would we want to, and say, this part of the county, you've got these rules, this part of the county, you've got those rules. So again, ultimately, the end of the day, it's not a political decision, it's going to be a health decision. And that's what we have to make, because that's how we save lives in the first place, and we need to continue to move on that path.
Thank you, Candace. Thank you very much. I'd like to move over to Debbie Chamberlain. And as we know, as we've tried to think about how we're going to allow our businesses open up, given the health rules and directives, the city and Debbie in particular have thought about what do we have to do as a city to help our businesses and our restaurants adapt to these new changes. So Debbie, can you share with us what the city is doing and might be thinking about doing?
Great, thank you. Good morning, everyone. Good morning, Mayor. Thank you for inviting me today. I really appreciate the opportunity to update our residents on what the city's been doing. And it's great to have my old friend Enrique here with me today. Welcome, sir. So the city, as you know, has been monitoring the health orders very closely. And in mid-May, we did recognize that restaurants would begin to open, and sooner than later was our hope, and they have. And I'm really pleased to see those restaurants with outdoor dining beginning to open. It's nice to see people outside and, getting a meal and being able to have that experience. In recognition of this and knowing that indoor dining was going to be some time off, the city wanted to make sure those businesses could reopen, but ensure that social distancing was maintained. So in late May, the council adopted a temporary outdoor restaurant seating and other commercial activities policy that would allow businesses to social distance, and they would allow to pursue these additional outdoor activities for up to 120 days after expiration of the health order, which we know is going to be a timeout. But we wanted to ensure that restaurants could and outdoor activities could expand outside their interior doors into their sidewalks, even into parking lots of shopping centers, so they could get that seating, and so they could reopen their businesses, have those employees come back and help open up our economy. So the great thing about this permit, it's free to all businesses, but we do ask that you come in and do get a permit, because there are certain things we need to look at, such as accessibility requirements that path the travel for ADA. but we really have it very loose. We look to you to propose what you're looking to do in consultation with your shopping center owner if you're in a shopping center. But really the whole goal is to be flexible and to really encourage those restaurants and those commercial activities that want to expand outside to do that, but to work with the city to ensure that it is safe for everyone and social distancing is maintained. So we've had a number of requests from our restaurants throughout San Ramon, which has been fantastic. I did my weekly drive around the city yesterday, and I was so excited to see, Clementine's is out there, Mexxi's is out there, Firehouse, Hop Yard, a number of restaurants have outdoor seating in place. And it's actually fantastic to see these restaurants open and serving our residents and taking care of their customers. So with that, that's really the main thing. We also do allow temporary signage so if you want to advertise that you're reopened now and what your hours of business are, please just call our permit center. We're happy to work with you. There are some time limitations, but as I mentioned, we are being flexible with those time limitations to ensure that you guys can all advertise your businesses that you're reopening and get your customers back and get your businesses back up and running. And also I want to promote Dine Out San Ramon. The council this month has declared June Dine Out San Ramon. We want to get our residents and their friends and families out experiencing our restaurants. And we hope that you all take advantage of Dine Out San Ramon and patronize all your favorite restaurants. I try to hit one a week, either through lunch or dinner, just say hello and welcome them back. So Mr. Mayor, anything else you'd like me to expand on, let me know.
Fantastic. I'm sure there may be some questions.
Right.
Enrique, thank you for being here. It should be noted, and I asked this question before, I think you are the second longest established restaurant anywhere here in San Ramon. The Brass Door, which has been around since the 1940s, 80 years almost, is our longest established restaurant. And I asked you here, not so much to promote Mexxi's. You are representative of the small business owners who have restaurants and who really have lots of challenges in terms of maintaining your business. And so if you could share with us the things that you're doing, what are the things that you're doing as a small business, allow people to come and get food at Mexxi's and remain safe? And by the way, show off your t-shirt when you start that too. No masks, no tacos.
Yes, please wear your masks everywhere you go, especially when you come to Mexxi's. Mayor, thank you for inviting me here. It's a pleasure to be here with you and share our perspective from the restaurant, inside the restaurant world. It's been very important to us to transition from the way things were just 3 months ago to the new normal. And there have been many agencies, especially the health department, where we were able to learn how to adapt, how to adjust to the new guidelines, how to do it, how to keep ourselves safe and therefore our customers, which is our primary concern. And so by educating ourselves, we were able to stay safe, to keep serving our community, which has been tremendous in supporting us. We've been here for almost 25 years. So thank you, San Ramon. Thank you, the Tri-Valley. And it was an adjustment to go from the way things were to every morning we come in and we check our temperatures. We make sure that everything is sanitized before we open for business. When products come in, like Candace was saying, Cisco orders come in, we sanitize them. We spray a little bit of a bleach solution and let them sit there for a little while before we move them into the building and into the refrigeration system. So by doing all those things, we've been able to stay safe and to continue to serve our community.
Your outdoor seating, what sort of steps have you taken outdoors to keep all your customers safe?
Well, since we were allowed to reopen just a couple weeks ago, we had some fencing and some barriers between tables. So for people dining outside, there's a separation between all the tables. That way they have that extra feeling of safety. And when we do open up inside, we'll have the acrylic barriers so that there's a separation. I don't know exactly what percentage of our capacity we'll be able to open with. But we're ready and waiting. You know, we're thinking that perhaps July 1st was going to be the opening day, but we'll stand by and be ready.
And most of our restaurants, I assume, cooperate with DoorDash and Grubhub and other services that actually people can order their food out and have it delivered to their homes from you, correct?
Sir, we, in the beginning, a while back, we were doing some deliveries, but I decided to go against that. We had some issues where people were receiving their food. It was cold and some food went to the wrong house. So I instituted a policy where it was just for our local neighbors, and we were not doing drop-off. We were delivering to our senior center, which is right around the corner,
Right.
and senior community. We were making deliveries directly to them. But yeah, we did not do DoorDash and such companies.
No, I appreciate hearing that because hearing what your challenges are as a business and the things that we can do to help you guys succeed is always important to hear. So Enrique, thank you very much. I know there may be some questions for you. So I know you have a big order to take care of. So if you do have to step out, we understand. You had this huge order come in this morning that you're trying to handle. So to the extent you can hang around, thank you very much.
Be happy to be here with you.
It's my pleasure now to reintroduce to everybody Dr. Joseph, who is going to and has some information he wants to present. And then I think we'll have time for people who have questions based on our subject. So Dr. Joseph, welcome again. And then the floor is yours.
Well, good morning. And as always, thank you. I think I learn so much from each of these just by listening to individuals around the county. And it always makes me proud to be in this county. I'm going to share my screen, if that's okay, Steve, if we can make that work. We'll give it a shot and see.
You should have the ability to share screen. If not,
We do.
here we go.
Okay, today is going to be a little bit different. I always had the opportunity and the pleasure to address science and things that we were doing in the field of molecular diagnostics and managing patients. And today I decided to go a little different direction. We'll review a little bit about protecting yourself and about what we know regarding the virus, and certainly be available for questions. But what has become clear from when we first started doing this is that this is not going away. There were so many predictions, and predictions are always fraught with problems and guessing. And I don't make predictions, rather I try to deal with what we have at hand and projections rather than predictions. But what's clear now is that we have to learn to live with this virus as opposed to waiting for it to go away. We now know that from the activities of the virus, it's very clear we have to change the way we think, the way we act, and what we do. So in the bottom right of this screen, I have put just some highlights of some of the things that we have seen as a memory refresher. You can see what happened on New Year's Eve, and we had our first case in late January. And then what made it on our kitchen table was the Diamond Princess quarantine, because that affected the Northern California area. We received patients from the Diamond Princess into Contra Costa County. And then we had the March 16th stay-at-home order. And that was the big event for all of us. It was the shelter-in-place order. And now we are starting to see that after 2 months, the beginning of the reopening. And the beginning of the reopening doesn't mean that we have controlled the virus. It means that we have tempered the virus. And that's what we're going to talk about today. So a little bit of a review. This is predominantly person-to-person spread. The orders that come down from our health officer really focuses on an infected person gives it to another person. There are an occasional case that occurs from a high touch area. So disinfecting high touch surfaces is important. And as I've said before, even if you touch an area that is heavily contaminated with virus because an individual just opened the door before you and had virus on his or her hands, you can't get that unless after touching the doorknob, you touch your face. It won't go through the skin, it won't go through your hands. But those are few. By and large, it's person-to-person spread. And this will be important as to how we plan our activities in the future. You can get it by just having a discussion with someone, as you can see in the upper left. And the biggest problem that all of us face is the way this virus acts with our immune system. And what I mean by that is it's contagious for 2 or 3 days before a person develops symptoms. And some individuals may never develop symptoms. But by and large, the risk here is, let's assume the gentleman on the left does not even know that he is carrying the virus, and he is exposing the person on the right just by having a conversation. And then, of course, what's worse than that is talking loudly, yelling, and sneezing or coughing. And that puts more virus in the air. And we're going to address this a little bit later in one of the questions. But the amount of virus that goes into the air from an infected person determines the contagiousness. Herd immunity is a concept that we have always hoped for and we will hope for. The upper left shows a typical community, and the red dots represent the number of people who are immune, either by vaccination or by recently having disease. And the guideline is 60%, the target is 80%. And as a comparative, we have herd immunity in Contra Costa County against measles, mumps, rubella, chickenpox, smallpox, many viral diseases. And what that means is if someone happens to enter our community and is infected and is contagious, it's unlikely that that's going to cause a problem because the majority of persons are immune. So it won't take off like the coronavirus has taken off. That's our target. Our target is herd immunity, and it's likely that we won't get there until a vaccine is effective. This gives you an idea of where we are in the country. New York, which has been tremendously seriously affected, is only about 20%. London is between 15 and 20%. And as was mentioned by Supervisor Andersen, we're only at about 5%. So we're nowhere near herd immunity, which means that the majority of individuals in our county are susceptible if exposed. Now, let's talk about what has happened. 3 months ago, we saw this virus taking hold and it was running quickly. And the concern was that we could exceed our healthcare capacity. What this meant to the health officials and to the scientists is if so many people got infected, we couldn't handle them. The ICUs would be full, which became one of our indicators. How much room do we have to care for sick people? And if we exceed the healthcare capacity, people die. If we can maintain healthcare capacity, people live. Very simply stated, we can't provide the good care that we know how to if we're overwhelmed. So the solution to that problem was a lockdown. And I use that term because it's emphatic. This was the shelter in place order. You put people at home. It is a method that has worked for centuries. You lock them down, you quarantine them, you keep them out of the public. And the curve below, I'm impressed at how many people know what this old epidemiologic term now means, flatten the curve. The red curve means what would have happened if there was no intervention, if we did not do the shelter in place, and we would have exceeded the healthcare system capacity as shown by the dotted line. And I heard Governor Newsom on television the other night on the local news, and he said it so well. We didn't flatten the curve, we smashed it. And everyone needs to take credit for that. Everyone cooperated. The shelter in place order, particularly in our county, was so effective that we never exceeded healthcare capacity, which is what has happened in New York, what has happened in certain parts of New Jersey, certainly in London and in Italy. We avoided that by tremendous cooperation of our community. Now, let's focus on the blue curve. The blue curve means that the virus isn't going away. It's actually lasting longer than if we did nothing. The time frame going out to the right means we are going to have to learn to live with this. And we're seeing changes in what we saw for the red curve. What we're now seeing over the past 3 months is a difference in population. So consider this something like a horse race. Those who are in front, the horses that are running the fastest, are still running the fastest. What I mean is they are the ones who are getting infected. They're still in the lead. The nursing home catastrophes that are occurring, the Marine barracks or the Armed Forces barracks, the closed areas where people can almost not avoid spreading this are still in the front runner. But the fastest horse, I mean the one that is making tremendous strides and very quickly heading toward the lead, are the younger people. That is people under the age of 40. They are rocket shipping to the front. That is where the number of new cases are occurring. And that appears to be increasing regularly. The causes are not yet known. As was mentioned earlier, we have tremendous contact tracing, looking at everyone who gets infected. So it's too early to say if it was because of the reopening, if it was because of Memorial Day celebration, going to the beach, the demonstrations, the protesters, the parties that are going on. It's too early to say that, but it's very clear that where we're seeing the spike in the United States and also in our county is in the younger individuals. And their social status is different from ours. What's important here, and I can say this as a scientist because I understand it, lockdown works, but lockdown is not sustainable. We have to figure out how to live with this virus as we reopen. Now, this is what goes on behind the scenes. We hear things like outdoor dining is acceptable and indoor dining may be coming, and there may be schools opening. Reopening is done by a lot of effort of deciding what not to do, what is completely unsafe. And it's a balance. And Mayor Clarkson brought this up to me weeks ago, if not a month ago, like, how do we balance this? And there are very, very smart people that have to consider the personal risk of an individual. Let's just say it's someone who is at greater risk of dying because of underlying disease or age. The risk to society. What happens if we have an outbreak in our society, and the workplace risk? Will it close down an essential workplace? Will it close down a fundamental workplace? What does it do to our economy? And all of these go into deciding what we can do and probably what not to do. The important thing here is that we don't go from slammed shut to wide open. Understand and work with the county health officers and the government that this is a graduated situation based on extremely thoughtful decisions. And this is going to be repeated a little bit here. Now, the title of this is Reopening is Not One Size Fits All. So on the left, we talked that the orders are based on personal risks. That is, what is going to be the risk of death of someone with underlying disease in our community, and what is the risk to society? Also, and I didn't mention this earlier, as we reopen, what is the risk of exceeding the capacity of our hospitals and doctors and nursing homes? Because if we exceed it, then we have unnecessary deaths. We also have to focus on maintaining essential services. And what I mean by that is we can't close down an essential service because there is an epidemic in one of those workplaces. And at the same time, it is critically important to maintain economic viability. You know, a scientist will shut the door straight and say, there'll be no infections, we'll just go lockdown forever. And that obviously is not a realistic decision. But I would love everybody to understand that the decisions are made, and the questions that are going to come up because of the decisions reflect multiple sources of expert input. My only input into the decisions have been made is science. I'm a doctor, but all of these other things are way beyond my expertise. And I'm so proud of our health officers and our supervisors who consider everything with all of those particular variables. Now, when I say one size fits all, let's just assume that there is, we're now in a stage where outdoor dining is permitted. Outdoor dining doesn't mean that it's appropriate for everyone. Just because it is said that it's permitted, then we have to decide, well, does that apply to me? And so the focus of my comments today is that you as an individual, or you as a head of a family, or you as a member of a family have to estimate your risk. And your risk will guide what you do, and it'll be different from your neighbors. So because something is open doesn't mean, well, now it's okay to do it. And I'm going to go through a very, very rudimentary risk calculation that we're working on. But for the time constraints that we have today, this will give you an idea, and hopefully you walk away with a concept rather than an absolute. So the first thing is, let's take a look at this scoring exercise. And I decided to make it numerical for ease of understanding, plus the fact I'm more scientifically oriented than fine arts. Let's take a look at a risk if infected. That is, an individual, you, me, Mayor Clarkson, Supervisor Andersen, any of us. What happens if we get infected, or any one of us? Well, how severe will that illness be? Well, if you have an underlying disease, an immunosuppressed state, advanced age, it's going to be bad. If you're 35 years old, otherwise healthy, the likelihood of a severe illness is low. And the likelihood of hospitalization, although not zero, is extremely low. So that's the first thing to consider and give yourself a score. The next component, if I get sick, or if a 30-year-old gets sick, what is the likelihood that that individual can spread that virus to someone else unknowingly? Well, if a 30-year-old lives in a house with a grandparent who is undergoing cancer chemotherapy, that's an extreme risk. If a 30-year-old is living in an apartment with another 30-year-old and is wise about what he or she does and only contacts other individuals of the same age, then that risk, although you can spread it, the consequences of that risk are lower. And perhaps I should change that second line to say the consequences of spreading the virus to others. And then what all of us have to consider if we're in the workforce is, if I get sick, what is my risk of an inability to provide for my family? And anyone who gets sick, even if you're young or healthy, you're going to be out of work for a while. Well, if you're a young person who's home from college, the chances of that affecting the ability to provide for others who are dependents is very low. On the other hand, if you are the breadwinner of your family, and if you get sick and you can't work for 2 weeks, only you can decide how important that is. So this is the first component. I'm going to show you the second one in a moment. But this is a scoring exercise of what is the risk if you as an individual get infected. Now, this is completely different. What is the risk of getting infected? And this is where we have to decide as individuals, in which activities do we participate? And when I say one size fits all, what I mean is what I elect to do and what everybody else elects to do on here, and what everybody who is watching will likely be different. So what is the risk of my getting infected? Well, the first thing is the community incidence. Incidence is the number of new cases a day, or the trend, and it's going up. It's going up in our community. It's going up nationwide with the exception of some pockets, but basically there's more virus out there to which I could be exposed. And the prevalence, that is how many people in our area are sick. And that also is going up. So there was a time when the testing was 2% positive. And now, even though we're doing more tests per day, the percentage of those who are carrying the virus is increasing. So it's on its way up, and more people are sick out there in the community. So think about that. This is what is my risk of getting infected. And then my daily activity. Does my daily activity actually negate all of that? In other words, if my daily activity is working from home, and let's assume that I'm an accountant or a stockbroker or investment advisor, and I never leave my house, well, the community incidence and the community prevalence won't calculate into my risk of getting infected. But if I'm an individual who is in the workforce or is out in our community, then my daily activity will put me at a particular risk. And only you can determine what that is based on the number of people that you come in contact with. So remember, we started off by saying this is a person-to-person virus. So your daily activity, that is how many people that you come into contact with, is part of determining your risk of getting exposed or infected. And then there's been this concept of a social bubble, exposure bubble, family bubble. And let me give you an example that I hear most commonly. I live on a particular street, but I live in a different house from my kids. And they are in my bubble. I want to see my kids. So I go to their house and they come to mine. Okay, that is your exposure bubble. Well, if your exposure bubble is very small, very limited, very controlled, then that's a very low risk. But if your exposure bubble includes a family that may have a 25-year-old child or several in that age group, and they're going to parties, well, your exposure bubble risk now has changed substantially because they can give the virus to someone in your bubble, and then that can be expressed to you. So these are all individual things. Now, the individual risk of getting infected, and here's where the variability occurs from me, how I differ from you, and how you differ from your neighbors. Once I understand my risk, and once I understand the community risk based on the first three, then we decide what we do. So let's pick an event. Is it safe for me to go outdoor dining? We know it's permitted, but is the risk too high for me, or is the risk acceptable? Everything that is opening, everything that we are now permitted to do is not risk-free. There is a risk with everything. There's a risk, but the risk may be low. So will I go to outdoor dining? Will I choose to go to indoor dining, shopping, retail? Am I going to go on a weekend trip with another family camping or to another town or to Tahoe? What about sporting events if they open up? Is that risk acceptable for me based on my individual circumstances? And air travel is opening up. And then, of course, you see this keeps getting increasing with concerts, large events, protest marches, and things like that. So the concept here is individuality. Understand your risk based on your activity, your bubble, and then decide what are you going to do today and what are you going to do with an invitation. And permitted does not mean without risk. Our county officials, government and health, have to decide what is permitted, but they're never saying that this is without risk. Only you can decide if something that is now permitted, is it for me? And that's the topic of what I wanted to get across today. This is an individual decision. We absolutely have to reopen. Lockdown is not sustainable, but don't consider what's open is okay for you. Feel free to make your personal decisions based on your own analysis of you, your family, and the likelihood of maybe spreading this without symptoms to someone who could have severe disease. So to emphasize, still, the way we prevent this virus from spreading is the hands, face, mask, space. Wash your hands or use hand sanitizer. And I often say, wash your hands as if you've just changed a baby's poop diaper. Seconds don't work. Singing songs don't work. Just think about what might be on your hands and wash them that thoroughly. Hand sanitizer, as long as it's 60% alcohol, is excellent. I think the dangerous products with wood alcohol have been removed from the market. Don't ever put wood alcohol on your hands. Keep your hands away from your face. If you don't touch your face, what's on your hands makes no difference until you wash them. You can get rid of it. Masks work. Masks save lives. Masks are not going away. Remember, masks protect you from someone else. You can be very, very conscientious and never walk out of your house without a mask. But if you get onto a subway, as it looks like that individual is doing, and everybody around you is not wearing a mask, you're at risk. So you're wearing a mask is a way to be socially conscious. And then, of course, socially distancing has been proven. It has been studied. It works. This virus will fall to the ground. It will not be spread from person to person if you stay away from each other. And so the last slide is this. Our future is uncertain. I ask you, don't try to listen to people who predict. This is like trying to predict what a shark is going to do. You can model, you can get some ideas, but it's better to prepare than predict. And I could give you tongue-in-cheek numerous predictions that have occurred over the past 3 months that have been so far off base, it's a lesson learned. The lesson learned is when someone tells you, well, this is what's going to happen, then be skeptical. They may be right, they may be wrong, but it's a roll of the dice. I've heard the term many times, and I think most of us understand it, that there's going to be another wave. Well, a better analogy is not a wave, but perhaps a fire, perhaps a forest fire or a brush fire. When you can suppress it, but when you back off, it flares up. You can suppress it, and that will go on and on and on until we reach either therapy or herd immunity. So be cautious of people who think they know what's going to happen next month, but be prepared for what could happen next month. And so with that, I will stop. I thank you again for inviting me. It's always a pleasure. This is a different concept for today, so we'll see how it goes.
You're muted, Bill.
I know. Thank you, Dr. Joseph. And we will take that little clip you did, and we're going to post that on our website for people who want to see that, who haven't had a chance this morning. So thank you. Steve, given the time we have, do we have any questions?
Yes, we do, Mayor. And again, info@sanramon.ca.gov is the email address to send in your questions. And I will try to condense questions together. We're getting a lot of detailed, longer questions, which I'd love to read, but we just don't have a lot of time. And also building on what the mayor said, we do post Dr. Joseph's presentations. We isolate them into clips on YouTube. So shameless plug here. If you feel that the information is valuable, you'd like to share, you can go directly to our YouTube site and take those links to those particular clips and share them via email or social media. The first question is, we've had a few questions about playgrounds opening up, and are there any plans for reopening playgrounds? And specifically, why are bars and gyms opening in July, but there's no mention of playgrounds?
I'm assuming that's to me.
Yeah, yes.
No, it's one I ask frequently. The reality is that the state, right, we like to blame the state, but they have not provided guidelines that allow us to open them up yet. And that's the reason. And certainly the distinction between a gym and a playground, yes, they both involve gripping equipment, but the gyms, when they do open, are required to follow some very strict sanitization requirements, social distancing requirements, things that you can't maintain in the same way on a playground.
Great, and that also leads to another question that we're receiving a lot of comments about. The requirements for Alameda County with their social bubbles are different than Contra Costa County, and also will we be following the state's guidelines to a T? So if you could address kind of the difference between guidelines between jurisdictions and counties in the state.
Yeah, early on, the counties in the Bay Area, we were being very consistent, lockstep in our orders. However, about a month ago, we did start to see more deviation with San Mateo opening things up quicker. We have opened up much quicker than both Alameda and Santa Clara County even. And even our July 1st order is quicker than theirs as well. And meaning if we move forward with it, they don't have on their timeline right now, indoor dining, gyms, things of that nature. Social bubbles, we've had a lot of discussion about it. And to be honest, I have not compared ours to Alameda County. That we've determined there is no magic in our 12 people social bubble. I think the health officer's desire was really to recognize we need that social interaction, and particularly our children need to have different groups they can interact with their school group, with their family group, and then with sort of an extracurricular group. So again, this is common sense. And this is what I keep telling people. We're not going to regulate and dictate all of your lives, but I will tell you that our health officers are seeing, because we do have the contact tracing, a large percentage of our cases are now coming from these informal gatherings, rather than because someone went into a store or they went into a restaurant. That's not the case. It's because they're having these informal gatherings, mixing up their social groups, their social bubbles. As Dr. Joseph suggested, you've got to assess your risk. And one of the reasons we're seeing this dramatic increase in our youth is, and when I say youth, I sound like an old timer, but people under 50 is because they are, they're having these informal, larger gatherings of individuals. And that's bringing us to have the spike in cases, which potentially could slow us down. And so use common sense. If you're going to get together with a group of people outside the social bubbles, wear masks, social distance, don't share, common food. You use common sense to protect the rest of us.
Great. Next question is for Enrique. How does having in-dining options as opposed to just takeout and delivery impact a restaurant's income? And also a follow-up to that, should I dine indoors or do you prefer that we just take out?
Well, by being inside, we are going to be operating at a reduced percentage of our total seating capacity. So that's why we expanded our patio dining. We are trying to keep it as safe as possible. We've installed all the barriers. So we've expanded, and that should provide more of a safety environment for our customers. And the reason to come out is to enjoy being at a table. The weather has been nice, and I think by social distancing, we are able to provide as safe as we can an environment for our patrons.
Great, thank you. Another question, and I'll try to summarize this one as best as possible. The Contra Costa County Health and the County Office of Education just recently released guidelines on Monday that have social distancing requirement proposals between 4 and 6 feet, wearing masks for students, creating cohorts of the same group of students to stay together, and various other options. So what is the safety, how shall I phrase this? I'm trying to find out.
The rationale for
the rationale, and also the risk involved with the difference between 4 and 6 feet and having the same cohort of students sitting together and also facing the same direction. So what are the safety risks involved with that?
Well, and a lot of it just comes down to science. Obviously, if you have the same cohort of students, you're not mixing and matching the germs that may be passed from one family to another. So that's a great factor. Originally we were saying 6 feet apart. We recognize you need to get more students in a classroom to be able to have that, the ability to teach, the ability for teachers to not have to have 2 or 3 or 4 sessions. And so 4 to 6 feet, I believe, just seemed like a reasonable number. Certainly, we're seeing in our children's camps, you can be a little bit closer as well. But again, on a regular basis for a school year, I think they felt that was a comfortable number. If you're all facing in the same direction, you're less likely to be spraying in each other's faces. I mean, that's, a lot of it is just sort of a common sense approach with what we know today. And as Dr. Joseph has pointed out, we don't know everything. There's so much about this disease, this virus we don't understand, but based on the science we have today, these seemed like reasonable ideas of how can we keep our children in school, safe, having this positive learning environment, and keep the teachers safe as well.
I think for Dr. Joseph, I think a lot of our educational leaders are struggling with this issue. And they're struggling with trying to create a learning environment and the constraints they have and keep their children safe. And I think they're looking for some direction. Not that you have all the answers always, although I think you have great answers. But in some ways, educators are looking and leaders are looking to the scientists. Is that appear to be safe? I think that was the essence of the question that might have been asked.
A very good question. So let's start off from the decision that was made and then go to maybe some science behind it. Every decision that is made like that is not made whimsically. It's made with input of a lot of different people, certainly what is necessary for education, what is available in the physical environment of the school, and then what is thought to be safe from the scientific approach. And those decisions that have been made, we have to understand that they're made with a lot of thought, but they're not made without the plan of follow-up. So because we have such tremendous contact tracing, if this doesn't work, it will be identified. But we have to believe that decisions that are made with a great deal of thought. Now, the science behind it it's a little bit of memory, but it goes like this. 6 feet apart without a mask and normal talking is safe. Okay, that's just the fact. The reason we wear a mask is because the two people that are 6 feet apart, one of them may unintentionally or unexpectedly cough or sneeze. So it's a little bit of belt and suspenders, and it's easy, it's safe. Now that's face-to-face discussion, face-to-face coughing, face-to-face sneezing. Without a mask, 6 feet, the virus will fall to the ground and not be infectious. With a mask, it even protects if a person inadvertently coughs or something as simple as clearing their throat. Just something like that actually produces a lot more virus, but it's face-to-face. The concept here is that the risk is proven to be lower if everyone is facing the same direction, because you don't get this virus into your face if someone is breathing behind you. So there is the safety factor of facing the same direction, the safety factor of the distance, the safety factor of the mask. All of this goes into what I think sounds like a very reasonable decision, but not one that is going to go without follow-up.
Thank you, sir.
All right, Mayor, we have time for a couple more. There's a question about the spike in cases, especially in young people, with the extremely large number of protests that have been going on. And have we seen the effect of that, given that the contagious period is still 14 to 21 days?
From the tracing, we have not yet been able to draw a direct nexus with the increase in cases to an actual protest or a series of protests, but we have encouraged those of you who have participated in peaceful protests or not so peaceful protests to go ahead and get tested. It's a good idea. It could be, again, that's why we sort of want you to know where you've been. And I think the challenge we have for those, excuse me, 40 or under, I'm going to say, you know, if you've been out to a protest, if you've been out shopping, if you've been out hanging out with friends, there are a lot of different places you may have been exposed. So we have not tied it directly to protests, but certainly that's a very, very strong possibility, especially if at any point in the rally, someone around you was unmasked or you were unmasked, because these weren't quiet rallies. This was yelling, this was chanting, and that opportunity to spray goes just even a little bit further in those situations, singing as well.
Great. Another question is someone is reporting that they're hearing of up to 55% of tests are false negatives. So I don't know if we have any statistics on the false negatives, but as an example, they said that one of their employees received a negative result, but all 5 people in the household tested positive. How soon should this person be retested? How realistic is it that that person is actually negative, and could that person be a carrier?
I would definitely suggest they get retested. We can ask Dr. Joseph. The test we're doing in the county has a very, very small percentage of false positives or false negatives. If it's an antibody testing, those are much more unreliable. But the testing we're doing with the nasal swab is, I want to say it's 0.3%, but I could be making that up. Dr. Joseph, what is your experience with the nasal swabs that we're doing? I'm hearing it's a very, very low percentage.
Yeah, false negative needs a definition.
Yep,
A false negative in laboratory science means that it was actually positive, but it was missed. That's unlikely. What is more likely is when a person has a negative test and later turns positive, is the test was done too early to detect the amount of virus that the laboratory method is designed. So for example, if I am exposed today and you do a nasal test on me every day, it is likely that the first 3 to 4 days will be negative. But after that, it will start to turn positive. So a false negative needs to be explained. A negative test in a person who is contagious is extremely unlikely.
Mm-hmm.
That would be a true false negative. That would mean that I'm shedding virus, but the test missed it. What is more likely is that I am not yet shedding enough virus to be contagious. And that's because the tests that we're talking about, the PCR test, is a very, very good test. Each of us, if everyone in my family gets infected, each of us will turn positive on a different day. So for the individual that you're speaking of, where his entire family was positive and he was not, he might be an individual who doesn't get infected, or he might later turn positive. And as mentioned, continue retesting if it is likely that a person has been exposed.
Steve, we have time for one more question if you have any.
Sure. There is one about reading a lot about blood types in COVID. And does a blood type make a difference in terms of infection rate and what COVID can do to you?
Oh, Dr. Joseph, have you?
That's not mine. I'm not taking that one.
Anecdotal at best. Blood type, patients with blood type O seem to do better. Not yet worked out as to if that's going to be sustainable, if it's going to be reproven, or the reasons if it is true. So that's all we know so far. Blood type O seem to do a little better.
Fantastic. I want to thank everybody for coming tonight. This morning. Enrique, thank you so much. We wish you and all our restaurants the best of luck as you begin to slowly reopen, especially your outdoor dining. I love what you've done with your new partitions. I got to stop by and enjoy my cheese enchiladas sometime soon. Thank you, Enrique.
Thank you very much.
Debbie, I appreciate what you're doing for all of our business owners and our restaurants and our retail people. I know they're all welcome to call you and contact you if they have any directions and need. You're doing a soft opening, and we'll have our counters open next week so people can get clarity either in person or over the phone. But again, thank you to all the staff people that are working so hard to make that work. Candace, again, you guys are carrying a heavy load. We appreciate your updates. We'll be all anticipating what's going to happen come Monday. Absolutely. Because folks like Enrique and other business owners are preparing for hopefully an opening, and we'll see what Monday brings for Wednesday. So thank you.
I hope so.
Dr. Joseph, your presentation again was wonderful. We will
Thank you.
clip that and create a presentation. As always, I learned so much about this, and I really think you're spot on. Some of the states that never really closed down, what they found is that 40% of the population self-contained anyway. And I think it goes to your point that a lot of people made individual decisions that what was in their best interest was to shelter in place despite the lack of restrictions. And it goes again to your point of not just assuming that things are opened up, it's safe. You need to make those individual decisions, especially when you have members of your pod, your bubble, who are at risk. So thank you.
Thank you.
And Steve, for keeping this coordinated, for keeping it on track and taking our questions. I appreciate everything you're doing. Everybody have a safe weekend. Enjoy all of San Ramon's restaurants. Go enjoy them. Go out and have a treat or order some food in, and have a wonderful and safe weekend. Thank you, everybody.
Thank you.